In Washington, Republicans in the U.S. Senate have yet to take a vote on the so-called Big Beautiful Bill that President Trump has urged them to pass. At least 4 GOP senators have said they will not vote for the bill. Another 6 are undecided.
With the fate of the measure still very much uncertain, Democrats continue their dire warnings about what they say would happen if the bill passes. Earlier today, I talked with Lieutenant Governor and Democratic candidate for governor Garlin Gilchrist about the legislation and what he says it would mean for people who depend on the government for health care. Lieutenant Governor, you, Governor Whitmer, and Democrats across the country have expressed concern about potential cuts to Medicaid and SNAP. Important programs that help people who are trying to make it in an economy that otherwise is not working in their favor. Tell me what your concerns are, and then I want to talk about what we think the reality is, because the bill that would make those cuts, presumably, has not moved. So tell me about your concerns.
Well, my concerns are first and foremost, with the experience of Michiganders who need the prices to be lowered, to be able to afford health care and medicine. And these drastic cuts, if the bill were to go into effect in the way that it came out of the House of Representatives, it would kick hundreds of thousands of people in Michigan out of their health care. What does that mean? It means pregnant women who can't have healthy pregnancies and could potentially have worse outcomes. Them or their kids could be severely injured or hurt, or could even pass away in childbirth. It means kids who cannot go to the doctor, can't go to the dentist because we have dental coverage that's covered by Medicaid in Michigan. It means seniors who wouldn't be able to afford their medicine or have access to the kind of long-term care that my own grandmother had for the last 10 years of her life that was paid for by Medicaid. So we are very concerned about those impacts on actual people's lived experience in the state of Michigan. Now, the legislative process is as messy in Washington as it is in Lansing. We need to make sure and advocate. We cannot let down our guard and let something pass or slip through that's going to hurt Michiganders. So we need to continue to let people know what is at stake, continue to let people know how our communities and our state would be harmed by the gutting of Medicaid, the gutting of food assistance, the gutting of the support of programs that are helping people and businesses across Michigan just to pay for tax cuts to persist for the wealthiest people in this country and the biggest companies. These things are hurting Michiganders and people need to know it.
When you look at a massive piece of legislation, which this is, there are disagreements. Republicans have said from the get-go that they don't think it has that kind of an impact, and it's very clear from the unified voice from you and your party that you clearly think that that would happen. But you also know, because you have more than little experience with the legislature, with your position in the Michigan Senate, that right now Republicans don't have the votes to get that passed, because if they did, they would have passed it. Are you encouraged that a different piece of legislation could be developed out of this, or are you just still concerned that this is still laying on the table?
My concern is less with the legislative process and more with the impact on Michiganders. My job as Lieutenant Governor now, my job going forward, continuing to serve people in Michigan, is to make sure that we can understand what their experiences are, see the problems as they are coming at us, and then work to head them off so they don't hit us, or that we have solutions to respond to the problems that get created from, whether it's this president, whether it's Republicans in Congress, Republicans in Michigan trying to emulate the Republicans in Congress. We have to make sure we're prepared for that. So look, the process is going to continue to work, continue to happen, but I am not excited at all looking forward to these programs getting cut. Medicaid getting cut means people dying faster in the state of Michigan. That is something we cannot and should not accept, and we're not going to take that laying down.
Mr. Lieutenant Governor, thank you for your time.
Thank you for having me.